Travoprost is a prostaglandin analog used in the treatment of elevated intraocular pressure due to open-angle glaucoma or ocular hypertension. In this video, let's found. What is Travoprost? What is Travoprost used for? Contraindication. What are the side effects of taking Travoprost? How does Travoprost work? How to use Travoprost? What is Travoprost? Travoprost, sold under the brand name Travatan among others, is a medication used to treat high pressure inside the eye including glaucoma. Specifically, it is used for open-angle glaucoma when other agents are not sufficient. It is used as an eye drop. Effects generally occur within 2 hours. Travoprost was approved for medical use in the United States and in the European Union in 2001. It is available as a generic medication in the United Kingdom. In 2020, it was the 304th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is Travoprost used for? Travoprost ophthalmic solution is indicated for the reduction of elevated intraocular pressure in patients with open-angle glaucoma or ocular hypertension. Travoprost is also currently indicated for the decrease of elevated intraocular pressure in pediatric patients aged 2 months to less than 18 years with ocular hypertension or pediatric glaucoma. Contraindication. Inflammation in the eye, e.g., iritis, uveitis, hypersensitivity. Side effects. Possible side effects are blurred vision, eyelid redness, permanent darkening of eyelashes, eye discomfort, permanent darkening of the iris to brown, heterochromia, burning sensation during use, thickening of the eyelashes, inflammation of the prostate gland, restricting urine flow, BPH. Pharmacodynamic. Travoprost, an isopropyl ester prodrug, is a synthetic prostaglandin F2-alpha analog that is rapidly hydrolyzed by esterases in the cornea to its biologically active free acid. The Travoprost free acid is potent and highly selective for the FP prostanoid receptor. Mechanism of action. Travoprost, a prostaglandin F2-alpha analog, is a highly selective full agonist which has a high affinity for the prostaglandin FP receptor, and facilitates reductions in intraocular pressure by increasing the outflow of aqueous humor via trabecular meshwork and uveoscleral pathways. Reduction of the intraocular pressure in man starts about 2 hours after administration and maximum effect is reached after 12 hours. Significant lowering of intraocular pressure can be maintained for periods exceeding 24 hours with a single dose. Half-life. The terminal elimination half-life of Travoprost free acid is determined to be approximately 45 minutes, although studies demonstrated half-life values that ranged from 17 to 86 minutes. Dose. Open-angle glaucoma. Indicated for reduction of elevated intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Instill 1 GTT in affected IQ day in the evening. Half-life. The terminal elimination half-life of Travoprost free acid is determined to be approximately 45 minutes, although studies demonstrated half-life values that ranged from 17 to 86 minutes. Dose. Open-angle glaucoma. Indicated for reduction of elevated intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Instill 1 GTT in affected IQ day in the evening.